Welcome, everyone, to a brand new webinar with Cosmetic Laser Dermatology. I'm very excited to be here today with Dr. Zubair, and he is going to be helping us all figure out how we can get holiday ready in time. We have a couple weeks before the holidays are here, but not only to get ready with treatments that can show results in time, but treatments that have zero or very little downtime. So I'm very excited to kind of have him go through these treatment options with you and hopefully give you guys some last minute ideas. We are booking up very quickly. Everyone likes to get in before the holidays. So whatever you find of interest today, we encourage you to get your time booked sooner rather than later so you can work it around your schedule. All right, to introduce Dr. Zubair, if you don't know him, he's one of our newer providers at Cosmetic Laser Dermatology. He's a board-certified dermatologist, and he did his fellowship training at Cosmetic Laser Dermatology under Dr. Mitchell Goldman and really with all of the doctors. He is very involved in our research center as well, and he actually has some really great new studies coming out. So if any of you have ever been involved in our research studies, you may have seen him on that end, which is right next door to us. But when he's at Cosmetic Laser Dermatology, Dr. Zubair, today he's speaking about no downtime treatments, but of course, he and all of our board certified dermatologists all offer the full gamut of aesthetic treatments. So everything from injectables to lasers to body sculpting to veins and really hair loss, anything in between. So and I have one more thing to note. Dr. Zubair, while he can do everything, I think we are seeing that he has a very special area of expertise with skin of color. And so many of his happy patients have, different shades of skin that react different to different lasers and treatments. And he's become very precise with how to best treat all these different skin tones. And of course, I think all of our doctors and dermatologists are interested in natural results, but Dr. Zubair especially, like very, very soft and natural results. So without further ado, Dr. Zubair, ready to share your presentation? Share your
Yes,
slide,
thank
and the
you so
floor is
much,
yours.
Risa. There we go. There we go. Risa, can you see my screen?
Yeah, if you just want to start the slideshow mode.
Beautiful. Okay.
Perfect.
Well, thank you, everyone. Welcome. Thanks for coming to my talk. So this slide is a little different. Some of our most impressive treatments produce gradual results, things like Sculptra or laser resurfacing, our Take 10 procedure, or laser scar treatment. But what about when you can't wait several months or, when you don't have time? I'll often have patients come in and they'll say things like, I have a wedding coming up in 3 weeks, their wedding. Or in my case, I rarely take time to get treated myself. And then I'll realize like, oh, I've been spending a lot of time in the sun and I have a dermatology conference coming up in less than a month. So in those cases, you don't have time to wait. So we're going to discuss things that have minimal to zero downtime and can make you look your best for the holidays or any situation where you need to get results sooner. So these are the things we're going to go over. We're going to talk about an introduction about like what's significant about like this time period. We're going to talk about like wrinkles and lines, how to treat red spots and brown spots, and then various growths, bumps, etc. So why are the holidays special? What's the reason for the season? What's the meaning of Christmas? So this is a time when we're surrounded by our oldest and closest relations. And in an ideal world, we would feel really safe to be vulnerable without fear of judgment. But that closeness also facilitates a certain brutal honesty. And sometimes we can receive some very direct remarks about our appearance, our aging, our weight, our skin, our hair. Often, every time when I go home, my family says like, Raheel, you don't look that healthy. Your skin is looking kind of dark. And I always thought it's funny because I used to have an ex-girlfriend from Austria. And when we would go to her family's house, her family would say, Cassandra, you're looking so pale. And so that was a really fascinating sociological phenomenon. But everyone experiences it, and we're more sensitive to the comments we get from our loved ones than we are from other people, than from strangers. You it's hard to win. You might hear like, why aren't you wearing makeup? Why you're wearing too much makeup? And that all that results in us feeling self-conscious, feeling under scrutiny, or more aware of our perceived flaws, at least. And then lastly, there's also a heightened visibility because we're going to take photos that are going to be around for a long time. They're going to go on Christmas cards. They're going to go on social media. So, that can weigh heavily on the mind. And it's a well-known phenomenon in medicine that even though this is a happy time, at least in theory, we often see that people's mental health struggles can get worse around the holiday season. Some of that may be because sometimes people are more aware if they're alone, but also even if people are with family members, they also can find their struggles a little heavier. So what can we do? Well, what would be the ideal treatments? Well, we prefer not to have a long downtime or recovery. We certainly don't want to be in the recovery period when our family sees us, because that can also be like a source of familial criticism. And we want fast results. So from today, Thanksgiving is only 15 days away. Hanukkah and Christmas are both 42 days away. We want to look not dramatically different, right? We don't want our family to find that a different person has come home. We want to feel confident and comfortable. And also, I think most importantly, we are more alienated than ever, and we have brief time to spend with our family. And I want to spend that time connecting with them and being present and making memories. And I don't want to be distracted thinking about, how I look. And so I think, the things we can do in this office to kind of boost our confidence, to let us feel comfortable in our own skin, I think those are the things we're going to be focusing on today. So we're going to start with wrinkles and lines. So first, we're going to talk about age-related changes. These are the things that cause those wrinkles and lines. So one is here, we're going to talk about the bone loss. So just like you lose bone in your spine and in our hips, we also lose it in our face. So particularly in our jawbone, our mandible, and then also in the cheekbones, which is particularly notable for women. And then as this gets thinner, the cheekbone and the jawbone, there's less kind of holding the skin tight. And so that's what causes the skin to kind of seem looser, to seem like there's extra skin. Same thing with our fat pads. These fat pads not only can shrivel up often when if we lose weight as we get older, but also regardless of our weight change, they will drift downward. And so like you can see on myself, this fat pad right here on my cheeks that used to cover up here underneath my eyes, as it moves downward, my under eye hollows get visible. Similar, and that often can make me look tired. Similarly, our temples can get hollow, which can make us look older. And then as that fat pad goes away from our eye, it weighs down here and can make our nasolabial fold heavier. And the fat pad over here, as that weighs down, it's going to give us jowling. So the fat is kind of moving away from where we want it to be into a place where we don't want it. And the nasolabial fold, the jowl fat pads, those can start making us look overweight as well as older. So how do we address these things? So this is a patient actually of Dr. Fabi. So this is a great example because this patient was treated over the course of 9 years. So this is an ideal, I think, of our aesthetic philosophy at the office, where she wasn't made to look like a different person. She looks like herself, but even at 42 years of age, she looks almost like a 30-year-old. So the things that were done here, you can see she's had some cheek filler and then some enhancement of the lower face and jawline, as well as the chin. You can see her skin is also better. That's good skincare, as well as lasers. But what's notable to the changes of the facial shape, that was what was done with filler. And it's incredible because over the course of 9 years, she doesn't look like she's aged. Her appearance has been preserved into the future. And that's also certainly one of our goals. Now, you can also treat like smaller areas, right? Like the previous patient, like I mentioned, like the first areas we often start with are treating like the cheekbones, the jawline, the lateral areas of the face, because those can lift and move those fat pads we were talking about. Now, this patient, for example, this is someone I treated about a year ago who was going home for Thanksgiving, and she wanted just a subtle lip enhancement. So this was very subtle. We used like something like half a syringe, but it's not, no one's going to be able to notice that she had lip filler. It's not going to look strange. She didn't have an unusual amount of like lip swelling or anything. So a very natural result. She also doesn't have any lip color on, believe it or not. It's just a better light reflection. And so these are the kind of results we're talking about, where you can look a little bit better without having a dramatic change. and then without worrying about, anything going wrong when you do things slowly and subtly. So facial expression wrinkles. So when we make facial expressions, if we make a frown, we develop these lines, these 11s. When we squint, we can develop these crow's feet like this from lifting our eyebrows. And as we get older, we tend to lift our eyebrows more just to even keep our eyelids and eyebrows up because the skin gets looser and heavier. We get these lines on the forehead. So just like, if you put your favorite Christmas sweater, if it's at least a tight weave, into a drawer, right, folded for like months, it's going to get a line in it. The same way as your muscles are folding your skin over and over again, you start getting these wrinkles, over the course of decades. And so we can start to relax those. And the way to address that is to start to relax the muscle. So we can relax the muscle with a couple different medications. We call these neuromodulators, but I call them wrinkle relaxers sometimes just to keep it simple. These include the medications Dysport, Botox, Daxxify, which is the newer medication that lasts longer. Now, a lot of people don't like the idea of doing Botox because, Botox and Dysport last about 3-4 months. Daxxify lasts more like 5 months, but they dislike the idea of, oh, is this something I have to keep doing? Well, not necessarily. I can say myself, like, I don't always make the time to get treated myself because I honestly just prefer treating other people more. But about twice a year, I'll get treated rather than like 3-4 times a year. So in those cases, I'll just get treated with the neuromodulator, enough for, let's say, for me to go to a conference, and it will last long enough for that. And then even if it wears off afterward, it's fine. Actually, right now, my neuromodulator is worn off, and that's okay because it's not like I'm going to be any worse off because I did it and then it wore off. If anything, I have like prevented worsening of the wrinkles. So if you're worried about it, about having to keep it up, you can always do like a small dose, and then that way it'll last a little shorter, but it'll last long enough to get you through the holidays, and it's also going to cost less as well. So we're going to show you, this is a patient who's much better looking than the previous people I was just showing. So here she's making a grimace, and you can see, like, even when she makes, a face like she got hit with a snowball, there's a lot less wrinkling. She can't make, even when she's trying to make an intense facial expression, she's still able to express, she's still able to be animated. There are just fewer wrinkles. And you're even seeing like her nasolabial folds are less intense because the muscles that pull it are relaxed. And so same thing here. This is, her smiling, and you're seeing less of the crow's feet. And the same thing, you're seeing the nasolabial folds look less intense too, as well as the lines, the bunny lines on the nose. So redness and brown spots, you don't want to be the butt of, any Rudolph jokes this year. And redness is worsened, by windy, cold, dry air, especially for those of us like myself who travel to the northern states for the holidays. That's the time our skin is under a lot more injury. Even though there's less sun, the cold and the dry air, whether it's dry from just being outside where it's dry, or from inside where everyone's running their heating, that can damage the skin barrier. And you have to moisturize more, but you're going to get more red. So you can preemptively prevent that redness by using either IPL or V-Beam. Those of you who are only in San Diego for the holidays, you're fortunate that it's not going to get worse for you. But this is a patient I treated similarly in the past year. So he had overall redness, but also you can see these like blood vessels on his nose, and these got better after a single treatment. So, and that single treatment, this one treatment later, this is a month later. So it's very feasible to have that improvement within a time frame, before Hanukkah, before Christmas comes up. And in terms of downtime, it's very minimal. So sometimes for this, there's redness for about a period of like 1 to 2 days, but it's very coverable with like just tinted sunscreen. Sometimes people really don't have much redness at all, extra redness. And then over the course of the next month, it's going to get lighter and lighter until it's gone. Same thing you can see here. And not even if the things aren't, we'll often say, depending on the amount of redness, like this patient, it wasn't too bad. And, we had a great result after one treatment, and then he didn't need any more. But sometimes if you have a lot of redness, or your problem may need several treatments, even if you get one treatment, you'll get some improvement. You'll get started. Things don't typically work in a fashion where you have to get several before you see any result. There's usually a result that's appreciable with every single treatment. So IPL, the previous patient, this patient was treated with V-beam, which is a laser specifically for redness. IPL, which our very own Dr. Goldman and our late Dr. Fitzpatrick invented. This is a really nice workhorse device. It's very versatile because it treats brown spots and red spots. There's minimal downtime. We're going to talk a little bit more about that. It's very fast. It is a high skill procedure. So this is something that there's a lot of offices that have this because, devices are expensive. And then a lot of med spas figure they can buy one of these and use it for everything. But, you have to be an expert and very careful with it. That's the irony, is that like, this is also the device that in the hands of people who don't have sufficient training, they end up hurting people. And then usually they end up coming to us to correct it. But it is a great option in the right hand. This is a patient who had IPL. This is them 2 months later. So she had quite a lot of intense redness, and she looks much, much less red here 2 months later. Similarly, this is another patient. Both these patients were treated by Dr. Goldman. Now, this patient had more brown. She had some redness too that you can see centrofacially, which is characteristic of rosacea. But she also had a lot of brown spots on the side of her face. And it's nice that IPL is a treatment that can get both. Now, I will say any device that is any energy-based device, whether it's a laser, whether it's IPL, anything that's gonna treat brown spots is gonna result in some tiny brown flecks, just like this patient has right here, you can see on her temple. That's gonna last for a couple of days. Thankfully, it's easy to cover up with like tinted sunscreen or with makeup. But it's a good thing in a way to see these because so the more sun damage you have, the more brown flecks you're going to have. She actually had a treatment with Fraxel before this, and then she had this treatment. And so she has you can see some brown flecks, but it's not that many. I treated a staff member, Haley, just last month, and like she keeps up with these things. So there's not that much that came off. It was just kind of a maintenance treatment. But if you have a lot of sun damage, you're going to have more brown flecks. But that's a good thing because those brown flecks represent the damaged collagen and the melanin from the sun damage coming up to the surface and being shed by the body. So more flecks means a better improvement. The more that's going to be shed, you're going to have a bigger result. So Fraxel and Alex, of course, we know has phenomenal result. This is a patient treated by Dr. Goldman. This is a patient treated by Dr. Bowen. Often you see that the patients look brighter in the photos afterward, and you can look at the background is actually slightly darker. So it's not that we adjusted the brightness. What happens is that when you get rid of all these brown spots on someone's face, they have less melanin, and so there's a better reflection of the light. So there's more light scattering off, and that's what we mean when we say patients look brighter. They have more like radiance. So your face is it's glowing in a way, is what you can see, especially with this patient on the right. And this was just after 2 treatments for that patient on the right. Often my patients, I'll tell them, you need in the range of like, 2 to 4 treatments, and then after 1 treatment, they're happy. And like, that's our ultimate endpoint, is like, once the patient feels happy and confident, there's no need to do any more treatments. And we can always adjust things, so if you have less downtime, we have the expertise that we can adjust the intensity of the treatment. If some of my patients will say like, I'm retired, I don't work, hit me like with the most intense treatment you can. I don't want to do this like a second or third time. And we're able to accommodate that request as well. But like, what if let's say on average, there's about 10 days where they'll have those brown flecks with this and like 2 to 3 days of redness swelling. Well, what if you don't have that kind of time? A really nice option is the Clear and Brilliant. I think of this as Fraxel's little sister. So there's no real downtime with this device. You're red for like that afternoon that you've treated the device. By the next day, it's gone. There's very fast healing. This is the most popular treatment our staff requests to have done on them because it's really easy to do. They don't have to worry about looking swollen or red. They can continue working that same day and the next day. People do more treatment sessions often than the Fraxel, but it's ultimately up to what you want to accomplish. Because if you're just looking to look a little bit refreshed, get a little bit of the sun damage off for the holidays, it's perfectly reasonable to do 1 treatment session. There's no need to do a series. And that's also a nice thing. I've always liked about our office, that we don't do packages, because the truth is, even though we can estimate, we don't 100% know how many treatments the patient's going to need. It's going to, like, how you respond. We have a good idea, but we don't know how you're going to feel about that, because many patients, they feel like they're really happy after like 1 or 2 treatments. And then, like, what was the purpose of locking them into 3 or 4 treatments? That's why we don't do that. Or, some people may be a little bit more perfectionist, in which case we find, okay, we may need to do another one. Um, Another thing about this laser, it's safe in all skin types, as I'll show you. I say no risk of PIH. Of course, like, in the wrong hands, almost anything is possible. But I've never seen any doctor here cause PIH with this laser. And with PIH, I mean post-inflammatory hyperpigmentation. So I've never seen any patient get burned. I've never seen any patient get darker. So this is a very safe laser with excellent results. We often actually use this laser when patients have hyperpigmentation from other things. They had like a chemical peel, or they were burned at another office, or they had a really bad flare of their acne, and they come in and they have PIH. This is often a great laser to improve that without worrying about the risk of it worsening. It's often combined with other treatments. So I often like to combine Clear and Brilliant and Picosecond at the same visit. And I'll talk about why I like to do that. And then it's a great maintenance option. So, if you have, once we achieve the result patients want, like, let's say you love the way you look, you don't feel like you've achieved your aesthetic goals, but you want to just preserve that result. And that, we are in, the land of the sun, and that we're at risk for losing, our aesthetic ideals. So this is something nice that you can do, that you don't have to worry about it, making you take time off work. And it's a very simple treatment to kind of maintain the results you've already achieved. So this is a patient that was treated by Dr. Bowen, a phenomenal result. And you can see she's like skin type 3, and she looks a lot brighter overall, and she can't help but smile more. This photo afterward. This is a patient I treated, and you can see that, she's a lot brighter looking. She has melasma. It's a very difficult treatment, a very difficult condition to treat. And this was after only a single treatment, which is phenomenal. It's a gentle laser for something that's no downtime. And like, it's a very comfortable laser to do. She had an excellent result. This is a picosecond laser. So this is a patient I treated with in 2 sessions. She had most of her result actually after 1 session. In the second session, we were just kind of cleaning up a little bit of what was left. She's skin type 4, Southeast Asian patient, which is often a very, very challenging skin type to treat, because I'm skin type 4, and we're often like the most reactive in terms of the most likely to get hyperpigmentation. So it can be very intimidating sometimes for some providers. You have to be very careful. Even with picosecond laser, it is the safest laser, but just like everything else I said, it has to be done the right way. It has to be done in the right hands. All the doctors here, we combine it with the right medications afterward. We're using like certain topical steroids afterward. We're making sure you're protecting yourself in the sun afterward. We're combining it with other lightening agents. So this patient, this result is absolutely phenomenal. And it's safe in all skin types, just like the Clear and Brilliant Permea. Minimal downtime, redness for about a day or 2. But that redness, I should say, is not very dramatic at all. It's like a light pinkness, and crusting, possible crusting, by which I mean like similar to the brown flecks we get with other lasers. And you're going to see that with any device that gets rid of brown spots, but it's easily, can be easily masked with tinted sunscreen or with makeup. Very effective for a lot of different kinds of pigmentation. And we can treat like both large, like intense spots like this, but also like background skin tone unevenness. And I often like to combine, we have 2 different picosecond lasers here. We had 3, but 2 was enough. We got rid of the 3rd. I often like to combine it with the Clear and Brilliant, because the Clear and Brilliant is really nice at getting rid of like the bulk of the pigmentation on the surface. But then sometimes people, especially people of like my skin type, will have post-inflammatory hyperpigmentation that's deeper. And it could be from like acne or from previous treatments. And so the picosecond laser is really good at getting the pigment that's at depth to clear that out. So you get a really nice result combining them both. You can combine them both safely without any additional downtime. So it's like you're getting more of a result, a more thorough result with an equal amount of downtime. This is another patient. This patient was treated by Dr. Wu. And this patient also had melasma, a notoriously difficult condition to treat, especially in an area as sunny as San Diego. And what can you say, beside wow, after this result? She had bad melasma on her forehead, cheeks, upper lip, and chin, and all of these are looking much lighter. That's a phenomenal result. All right, so the last thing we're going to talk about are lumps, bumps, and growths. So I like to think of these all as a category of things that your little niece or your grandson kind of point to and go like, oh, what's that on Uncle's face? The brutal honesty of children. So barnacles, these are what we call seborrheic keratoses. They're not caused by the sun, unfortunately. They're just caused by more birthdays. I tell people these are a sign you're getting younger. Angiomas, these are just benign growths of blood vessels. There's no way to prevent either of these. And then overgrown oil glands or sebaceous hyperplasia. So these we can try to prevent with retinoids, but once they're there, they're kind of hard to make away just with skincare alone. All of these things are completely benign. And that's also the benefit is if you're unsure and you come to this office, all of the physicians here are board certified dermatologists. We completed residency. All of us did, we did thousands of skin cancer surgeries before we went and did our cosmetic fellowships. And so we're able to tell you, like with complete confidence, is this lesion cancerous and something you have to come see us on the skin and cancer side to get evaluated? Or is it benign and something that we can treat like any of these lesions? These can be treated in various ways. For seborrheic keratoses and for sebaceous hyperplasia, I often like using the ultra clear laser. The ultra pulse laser can also be used. If the seborrheic keratoses are brown, then you can actually use the alexandrite laser because they have melanin, which you can pick up. And that's nice because like when you treat these, they'll just be kind of like flaky spots for a week or so. And then they'll basically like peel off, they'll be gone. So it's something really nice to get rid of these without having, similarly, you don't have to take any time off work. It's not anything that's going to make you look, crazy for the next couple of days. The middle ones, the angiomas, these are even easier to treat. They're treated with the V-beam, and they turn a little bit, they change color, they turn a little bit purple, and then they just kind of like get smaller and smaller and smaller over the course of a month. But the nice thing is that laser will protect like the surrounding skin. So it's only the blood vessel growth, the angioma that gets hurt. But these are all things that, that can kind of bother us. They're reminders of our age. But it's nice to be able to treat these without having to undergo something that's intense and something you have to like plan for. And so lastly, we're going to talk about acne. So some of our acne treatments generally take a long time, whether you're doing, topicals or medication, notoriously, at best, you can kind of see results at 6 weeks. But we tell patients that you really have to try something for at least 3 months before you say that it's failed. But now we have like some new devices that, there was a discovery of a laser wavelength that is able to treat that oil gland without damaging the surrounding skin. That was a discovery about 2.5 years ago. And so they created this device, the Apure, and that has kind of changed the paradigm a bit. So what you're seeing here is actually a result from a presentation I gave at the American Society of Dermatologic Surgery, showing our data from our study looking at the Apure laser for acne. And so what you're seeing is even every single treatment, people are getting an improvement. So they had their first treatment, and then a month later, by their second treatment, they have this 30% reduction in lesion count. So what that means is we counted how many pimples they had, how many comedones, how many inflamed blackheads, how many inflamed papules, pustules, how many blackheads, whiteheads, and then that number reduced by 30%. And of course, with more treatments, more of them reduced, but even 1 month later with a single treatment, there was almost a 1/3 reduction in these. So even if you don't have the time yet, you want to get ready before you don't have the 4 months before the holidays, before your big event, like even getting started on the treatment, you're going to see some results. This is a result actually from Dr. Kilmer. We have a lot of before and after photos from both our trials and from patients we've treated, but they're all from like patients we've treated pretty much like 3 or 4 times. But this is a patient who was treated just one time, which is what I wanted to focus on because we're talking about things that you can get results sooner. So this patient had bad acne on the back, which is a notoriously difficult area to treat, often only responsive to Accutane. But this patient, you can see, had a great result with the Acure after a single treatment. And this is 13 months later. So they didn't have to actually keep up with doing the laser. That's another amazing thing we're finding. And the Acure laser just got an FDA approval based on that study I just showed you, that the FDA confirmed that their results did demonstrate a durable improvement with acne. And the only other thing that's capable of doing that beside the lasers is Accutane, is oral medication. So laser hair reduction, also a no downtime treatment. It's safe in all skin types if done by an expert. When it's not done by an expert, that's actually the most common cause of lawsuits is when, these med spas are using IPL for hair removal, which we never do. And no matter where you go, please don't let them do that. Make sure you have someone using an Alexandrite or an Nd:YAG laser like we do. That's going to make sure that the skin is protected as that hair follicle is damaged. Even 1 to 2 treatments will reduce the amount of hair. So 1 to 2 treatments is realistically not going to get rid of all your hair for a long period of time, but it will reduce the amount enough that you don't have to worry about, dermaplaning or shaving while you're on your trip. It's going to be enough to get rid of the hairs that were in the growth phase there. So it's worthwhile to still get started on this. And so, the different things we talked about, these I think are a nice way that we can reward and treat ourselves and make ourselves feel better going into this season, which we want to feel our best about, and we don't want to feel anxious. We covered a lot of different things, and I hope I didn't go too fast, but we have more time for questions that way. I know that was very popular last webinar. So we talked about filler for skin laxity, age-related changes. We talked about wrinkle relaxers, Botox, Dysport, Daxxify for those lines we get from facial expression from the crow's feet, the 11s, the forehead lines. There are many other areas we can treat. We talked about V-beam and IPL for redness and for clear and brilliant for brown spots and skin tone evenness. We did talk about other things like Pico and Fraxel, but these are the ones that I think are the ones that you're going to see the fastest result and have the least downtime. So these are to avoid getting overwhelmed by decision. I would say like this is the takeaway slide for things you may think about getting done in the next like 6 weeks or so. All right, thank you. I hope everyone has a great Thanksgiving and Hanukkah and Christmas. If you have any questions, you can feel free to call the office or you can email me. But let's take questions actually right now.
Okay, perfect. Thank you so much, Dr. Zubair. That was great, and it was so festive. I loved your graphics here. All right, so we will just take down so you guys can all see Dr. Zubair a little bit bigger now. So at this time, as some of you are already doing, please feel free to start submitting your questions with the Q&A feature, and we'll get to as many as possible. So here we go. What treatments are ideal for skin of color, especially if they're prone to hyperpigmentation and melasma? Is there anything aside from Pico and Clear and Brilliant?
That's a great question. So Pico, so I should say that for melasma and for post-inflammatory hyperpigmentation, so the Clear and Brilliant and the Pico, and I should say honestly, any laser procedure should be thought of as an adjunctive. Even though those are the expensive things and they're the things we do in this office and the things we spend a lot of time trained to do, any doctor will tell you the mainstay for treating melasma is, there are 3 arms, of which procedures are just one, and they're the least important arm. The 2 more important arms are going to be photoprotection, protection from the sun, which is making sure you have a good sunscreen, making sure you're applying enough of that sunscreen. Ideally, it should be a tinted sunscreen. I actually, many years ago, used to work in a photobiology unit where I was working with companies like like Estee Lauder, like L'Oreal to develop new, and I actually did develop new sunscreen ingredients. Um, these, what we found was like, especially for people with skin of color, we more easily make pigmentation. You know, if you saw my last webinar, we talked it, which is still available if you want to learn more about this topic, but we talked about how our skin types make melanin more readily as a defense to protect our skin, no matter what the cause of the injury was. Just like some people with lighter skin types tend to get more redness. And so tinted sunscreen is effective because the iron oxide, and I hope I'm not getting too granular or confusing. I just love talking about this stuff. The iron oxide that's in tinted sunscreen is able to block like the blue light and the visible light from the sun, which can also make melasma and post-inflammatory hyperpigmentation worse. The thing that makes the most worse, that the wavelengths, the part of the sunlight that makes melasma worse and post-PIH worse is UVA combined with visible light. And that those forms of light, unfortunately, are the kind that can penetrate glass. They can penetrate through clouds. So even if it's a cloudy day, even if you're behind your windshield, those forms of light can get in. So that's why it's useful to wear tinted sunscreen. Now, some people, you know, it's hard sometimes for some skin types to find, and there have been studies on this, tinted sunscreen that matches. And the sunscreen companies used to only make like one shade universal shade sunscreens, and they would say it'll blend in, but that wasn't true for everyone's skin type. And now they're kind of catching on. And I'm happy I've seen like Neutrogena, Color Science, I've seen Senti. I've seen a lot more companies come out with multi-shade products. Now we just got in stock Alta MD. I used to use their UV Clear sunscreen forever. For I used to have acne and bad PIH, and that is the best sunscreen for that. And now we just ordered the deep tint version of that, which is really nice for those of us who have like more melanated. So one, I talked a lot about sunscreen, but also, you know, making sure, you know, we live in San Diego, we pay quite a premium to live in San Diego. So I would never tell anyone, you know, to become a recluse and avoid the sun. I think that's a beautiful thing to be able to enjoy nature as much as we can. But whatever outdoor activities you like to do, if you can, and the times you can, try to do them like before 10 a.m. or after 3, 4 p.m., not midday. You know, the sun's going to be less intense in the morning and in the late afternoon and the evening. That'll help you avoid, you know, worsening your skin condition. So that's the sun protection arm. And of course, if you don't like to use sunscreen, you can always wear like a wide brim hat. Many people often wear sleeves in the car, like just keep a pair of
gloves.
exactly of gloves and sleeves, like bringing back the 20s. It's very, I think, very fashionable. And then the next most important arm after photo protection, after sun protection, is lightening agents. So these are things like combinations of hydroquinone and mild topical retinoid and mild steroids. So like this was called the Kligman formula. And this combination, which we at the office, we're going to ask you questions about like your how sensitive your skin is, because that's something that can often put patients off, is it can be irritating. So your doctor has to spend a lot of time talking with you about, you know, do you have sensitive skin? Do you have dry skin? Because then we might scale back on the intensity. Maybe we'll use like a 4% hydroquinone. Maybe we'll only use it every other day. Or we might not even use hydroquinone at all. We have some nice non-hydroquinone lightening options in the office now too, which is great. We have Elastin Illuminate's one of my favorite products. We actually did the studies for that product where we tested it against 4% hydroquinone, and I was a blinded investigator, so I didn't know what the patients got. And it was incredible that it was just as good at lightening for people with melasma, and patients found like it was also like more moisturizing on their skin. So something that it doesn't cause like any of the irritation that hydroquinone causes. And I'd be happy to talk in more depth at another time about like the misinformation about hydroquinone, but it's excellent that for people with sensitive skin, there is an option that's not going to be as irritating, or just if anyone, even if anyone is concerned about using hydroquinone, like I think it's very reasonable. Like as an example, if you're pregnant or trying to get pregnant, you can't use the Kligman formula because you can't use a topical retinoid. And so, but it's perfectly safe for you to use elastin illuminate. None of those ingredients, those peptides, would cross a placental barrier, and those are not going to get anywhere past your skin. So that's perfectly safe to use. We also use another very effective ingredient is oral tranexamic acid. Now, oral tranexamic acid is even better than topical tranexamic acid. This is a prescription drug. And it's astonishing me that on websites that like Muesli, they are, prescribing this to people, without like actually, bringing the patient in and like giving them like taking a thorough history, because, you know, there are some conditions where people really should not be on the medication. Like if you're pregnant, if you're on oral contraceptives, if you're a smoker, if you have a history of like blood clots, um, in those cases, people definitely should not be on the medication. But for most people who don't fit into those categories, it is an astonishingly effective medication. So it makes a big difference. And so, treating melasma is a tough condition. It's a lot easier to treat when, you live in areas like Minnesota or, Massachusetts, and it's harder to treat when you live in San Diego. But we are very effective. You saw some of our results. All of those patients who had melasma, none of them, I promise you, just got treated with the lasers alone. They were getting a combination of all those things. And so, and that's, I think, some of the benefit of like you're working with a doctor. It's very hard, I feel for patients, it's very hard to manage, try to do the research and like wade through all the marketing and propaganda and advertising. And there is, I'll say at least this good thing about medicine, there is a certain like honesty, integrity that when you see a physician, we are recommending to you what is best for your health, your safety, and your outcome. And we're giving you a comprehensive treatment plan. And I can tell you, honestly, and anyone at our office can tell you, a lot of times patients come to see me, and some of the patients aren't always, some of the patients who see me are students, and they can't necessarily afford to do like 4 to 6 laser treatments, but they're still able to like, manage with sun protection and like do, topicals. And they might be able to do like, getting, when their wedding is coming up, they may do like one Clear and Brilliant or something. And, they're able to have an improvement and a good result without having to spend a fortune. So yes, to answer your question, there's a lot of things you can do, but beyond the things we talked about.
Got it. That is really helpful. And I think you touched on so many great things about our philosophy with the combination treatment. And I'll just add one more little thing. There often may be a research study also available for someone. If they can't afford treatment, we may have a study enrolling, for Clear and Brilliant or for something else that you could be a candidate for. And so that's another benefit of coming to see Dr. Zubair or anyone at Cosmetic Laser Dermatology.
Risa, I don't know if that's going to sound like we set this up, but as you mentioned it, actually, we do have a study going on right now for Clear and Brilliant. It's a study with Clear and Brilliant and with skin pseudophilus vitamin C. So it is that's
May
the
have known that.
best vitamin C product there is. It can come at a premium, but I always tell patients actually, like I often try to recommend like inexpensive things for skincare. And I say, like, if you're going to spend money on one thing, though, make it your vitamin C, because that
Yeah.
is the formulation that a skincare company can mess up, that can get oxidized. Um, but so with the study, you can get the vitamin C for free, and you're getting Clear and Brilliance for free. So
Yeah.
it's a great way to try a treatment at no cost.
And sometimes you even get compensation for being part of our research.
Yes,
So,
sometimes you get paid. Like we're doing another study we're doing right now is masseter Botox.
oh my gosh, you guys, we have only one spot left, I think. So if
Yes.
anyone gets like a wide jaw, okay, we're getting off topic, but it is
Anyone
available.
who like if you clench your jaw, or
You feel
grind your
here, or
yeah.
like you clench your teeth at night.
Yeah.
Dr. Zubair did my masseter Botox. It also helps slim the face, but for me, it was teeth grinding. Okay, so back to on track here. Thank you for that answer. So how about laser treatments for acne? Someone's asking if it also works for folliculitis. Maybe you
That's a
can
good
tell everyone
question.
what folliculitis is real fast.
So folliculitis is similar to acne. So acne is multifactorial. Folliculitis means you have like inflammation of the hair follicle. So I'm actually gonna let me actually share my screen. Um, mhm. Actually gonna draw with this whiteboard. Let's see how this works. It's the first time I'm doing this. Um,
Okay, and a few people are asking about how to sign up for the study, so I'll just pop that in the chat while you're pulling this up.
yeah. Okay, so can everyone see? Okay, so let's say you have
Yes,
here,
we
this,
see.
this is like your hair follicle.
Mm-hmm.
So this is on the outside, this is your skin. And basically think of this as a pore, right? So a hair follicle will grow out of this. I'm very bad at drawing. So like that. Now you will have out attached to here like an oil gland that like drains a duct like into this. Um, Now what happens with acne is like people's skin doesn't exfoliate, right? And so basically the skin cells get stuck together and they can kind of block this opening, right? And then that leads to other problems because that gets blocked. And then like let me do a different color. So like then like this builds up, your sebum, your oil gland is like blocked. It can't get out. This is filling up. And then if the reason it happens during like puberty and then also hormonal triggers like you know changing your birth control, et cetera, can worsen acne is because the hormones can stimulate that sebaceous gland, that oil gland. And then what happens is the bacteria that, the C. acnes bacteria that normally live in our skin, they want to eat that oil. So they are going to get inside here, inside this hair follicle, get into this, and then your white blood cells, I feel like John Madden.
This is amazing. Live art
Yeah, I
here.
know. So your white blood cells here are gonna like pick up on this and say like, hey, there's bacteria inside the skin. They're only supposed to be on the outside. So they're gonna get really angry about that. They're gonna make everything, they're gonna make this super inflamed and angry. So acne is a complex process. So that's why it's like multifactorial to treat it. When you use the laser, the Acure, or when you do Accutane, what it's doing is shrinking this gland to like decrease its activity. So there is not as much food for the bacteria. And so your skin is not as oily as well, which also improves a lot of other things. So people don't feel as greasy. They don't get as much sebaceous filaments. They don't get as many blackheads and whiteheads. Improves, and it also when you're on some medications like retinoids, they're working on a lot of different methods. They're improving that skin turnover as well. Now, that's acne. It's complicated, but you can also get just plain folliculitis, and that happens like when people get like buttony or when we were wearing masks during COVID, and we were getting like you were getting pimples on the area where the mask is from the pressure, or if you wear a wetsuit or you're wearing like a sports bra and you're getting like acne and like you're getting like little bumps on the body in those areas. That's just that's not this whole multifactorial process. That's really just there's pressure, there's irritation of the hair follicle. It's not really related to the turnover. And then like still the bacteria on the skin are getting inside and it's getting inflamed. In that case, you don't really need, because it's not the you don't really need the laser to treat the sebaceous gland. You can pretty much just treat it with like benzoyl peroxide wash. And we have actually we can ship it to you. We also have it online. 5% benzoyl peroxide wash. It's a really nice ingredient because it's not ingredient. It's not irritating. People have used in the past, they used to use benzoyl peroxide cream, which was really drying. But if you just use the wash, it still is able to like kill the bacteria. I often recommend it to people to use like several times a week in the shower. And it because there's essentially like no side effects. It's on the body, 5%. You're not going to find it drying. You're not going to find it irritating. It's going to reduce the bacterial load. You're going to get less folliculitis. The one side effect you have to watch out for is like you want to use it a towel you don't care about to dry yourself off because it's going to bleach the towel.
Yeah.
But it's that's thankfully that's something you don't actually need the laser for. Now, if you want to probably see a doctor to be able to tell the difference. Are you getting, because on the chest and on the back and on the shoulders, that often is acne, not folliculitis. So if it's on the face, the neck, the shoulders, upper back, the upper chest, that's probably more likely acne where you can benefit from the laser. But if it's like in the, on the I see it on like so many people in San Diego because everyone's so athletic, on like the back of the thighs, on the thighs, on the butt, um, on the abdomen, that's more likely folliculitis.
Okay, that was amazing. All right. We have a couple more questions to get through, hopefully, so we can let everyone get on with their evening here. Thank you for sharing this art with us. That was so cool. All right, so let's see. Can milia be removed in any of these laser treatments, or is that more of an esthetician service?
That's a good question. So milia, what are milia? So milia, I'm going to show you. Similarly, it's like some part of the skin got folded, right? And then there's something that's stuck in there. Typically, it's basically just dead skin, right? And normally your skin exfoliates, but for some reason, we don't know why it happens. When it got folded, that exfoliated skin can't get out. So it gets filled basically with dead skin, which is mostly made up of keratin, of the protein keratin. And so if you've ever seen someone who has gotten a cyst on their skin, which we are actually wrapping up a study for, we found a new treatment for it. But that's the same thing as the milia. Milia is just a teeny tiny version. Some of the reason people get milia, there used to be a trend a couple of years ago where people were slugging, and so they were putting all the time like a lot of petrolatum jelly on their face. And it's okay to use sometimes a little bit of like Vaseline or petrolatum is great on like a wound, but all the time on your face can sometimes contribute to milia. Also, sometimes depending on people were using like certain comedogenic oils, like if you're using sometimes like shea butter or you can find like lists of comedogenicity on the internet, but it's very hard to figure out actually. It's actually an open question in the chemistry and science of skincare. It's hard to figure out like which oils contribute to acne the most and which don't so much. But anyway, so sometimes when you're putting a lot of heavy things on, you can get milia. Like it'll happen, for example, interestingly, people will get laser resurfacing and where they're putting on a lot of ointment on their face to protect their baby skin that's coming up. And they might get actually a little bit of milia. Thankfully, those milia we often find are temporary. So
Mhm.
with like a month later, they're gone. You can notice them because the skin is very thin, but they'll get shed with the normal turnover of the skin. But sometimes people have like some milia that are more, not from laser resurfacing, but in general, people will have milia that are more deep set. So what can be done? Sometimes you can extract them. So individually, an esthetician or a dermatologist or a nurse can like, with a comb and an extractor, don't try this at home because you can give yourself a scar. You can carefully squeeze it out. Um, Another thing like maintenance treatments to prevent these and to kind of help them come out, you can use a retinoid or you can use either like anything. We call these agents like keratolytics to help break apart, help chemically exfoliate the skin. So there's things like glycolic acid, salicylic acid. A really nice one is we have our AHA BHA cleanser, which stands for alpha hydroxy acid and beta hydroxy acid. It's a really nice wash. I've been using it actually since, surprisingly, despite the name, it's not irritating.
I'll
So even
link
if you
that for everyone in the
yeah,
chat.
even if you have sensitive skin, you can use that one. If you want to do something more intense, you could see like our esthetician Farzana. She can do like a chemical peel. You know, she has a great one, the VIP Purify. She did for me when I had worse acne. Um, and all of those things I'm talking about are going to help break apart the skin cells so that that layer can turn over and so that folded in area can be open and can kind of get shed. In terms of lasers, so I have had some patients who had some like really buried like milia with scar. And in her case, we were able to use the ultra pulse laser to improve both those scars and the milia because they were so deep set that like it was just too deep for a chemical peel to get to. And that's the kind of thing that we're gonna, you come to our office and we're one office. So I have no hesitancy to tell a patient, like, you know what, you're probably better off like seeing Farzana first, our esthetician, because she's going to be able to, do something that's, maybe a little less expensive or going to, be like less side effects. You're going to have a better experience. trying this chemical peel first. So an example might be like patients sometimes, often patients of like South Asian descent have brown, like pigmentation around their eyes, just genetically. And that can be tough to improve with the laser. So I say see Farzan because she does a really great job with chemical peels and sometimes microneedling of getting rid of that. And then if it's not responding, then I sometimes address it with laser. Similarly, with the milia, often we'll work together where she will first approach it with, chemical peels, get rid of a lot of it. I've had patients who did like Accutane, but they still had like some cysts and some milia that were just so deep. And I treated those patients afterward with radio frequency microneedling with laser. But first, I had them see Farzana. She was able to clear up a lot of things with extraction with chemical peels, but they had just a few things like some deep areas that had to be subcised afterward. And then that was the nice thing about our office and our partnerships is that we have our different areas of specialization, and so we can help each other out that way. You'll see that like if I have a patient who wants threads, I'll refer them to Dr. Butterick or Dr. Fabi. If there's a patient who wants some of the cellulite treatments that we offer, I'll refer them to Dr. Butterick. Patients who are sometimes like skin of color that are going to be challenging, I get referred. So that's a nice thing about the scale of our office.
Love that. Okay, we have like 1 minute. Can I try and get one more question in with like a short? I know
I'll try to keep it
this is
short.
why we love Dr.
I'm so
Zubair.
bad at doing that.
Okay. Are there any lasers for dark circles under our eyes that are a quick fix before the holidays?
Yeah, so dark circles are a very common problem. It's been estimated that women will spend like thousands of dollars in their lifetime. I don't have the exact statistic in front of me, but over their lifetime, they'll spend something like 10 grand, and even if they don't get a procedure, if you think about all of the skincare products they're trying to use with their lifetime, often ineffectually, it adds up. So under eye darkness can be from many different things, sometimes, and sometimes it's multiple things. So sometimes it's like I was saying, it's that the fat pad has drifted downward, like in my case, and so it's sunken. So there's a shadow underneath the eye. So if that's the case, then you need to kind of do something to restore the volume to make that shadow better. So, you could do filler. You could do either like filler, or you could do Sculptra to stimulate the skin. Sometimes, often what we recommend, because it can be tricky to do filler underneath the eye, I really only recommend it to people who are the ideal candidate. We can actually use filler. Often we start kind of in the cheeks, and that'll often reposition these fat pads, pull them up higher back to where they used to be, to kind of cover that hollow a little bit. And that's nice because it's much less, there's none of the risks or none of the problems you get with under eye filler, where it can be visible, where it can move. When you're doing cheek filler, it's much safer. It's deep, so people don't see it. It's a much more natural looking result. And so we always approach things that way to make sure you have the most natural result, the least complications. But you asked about laser. So now, if the other causes, sometimes it's from blood vessels. So this is some of the thinnest skin in our body. And so it's easy to see the blood vessels underneath that can be blue, they can be red. So sometimes we can laser those blood vessels, and that can make them less visible, or we can use different things to thicken that skin. We can use topical treatments like a mild retinoid. This is thin skin, like I said, so it's sensitive. So something like our Skin Medica 0.25 retinol complex, don't use the 0.5 or the 1.0 to start with because it's going to be too intense. But the 0.25 is like a nice moisturizing vehicle. It's like low intensity. With retinoids, it's more about consistency than intensity. So it's better to use a weak one every day than to use a strong one. And the strong ones really are more for acne. So even a weak one is sufficient to prevent aging and to help thicken the skin, to kind of to mask some of that vasculature a little bit. The retinol can help a little bit with pigmentation. Sculptra, actually our paper, Dr. Fabi and I published in our research unit, published a landmark paper. It was the first study in human beings to show that Sculptra can grow. Not only we knew that it can thicken the skin, but it was the first study to show that it can also stimulate your body to make fat. And like I was saying, you lose fat here. So not only does the skin, thin with age and with sun exposure, but you lose the fat. And so it's truly regenerative because it's not only like thickening the skin. We used to wonder, like, okay, is it just making scar tissue? Is it just what it like? Is it just it's creating collagen? But now we know, like, no, this is we did the biopsies ourselves. I looked at them myself under the microscope. I did the ultrasounds. That it's regenerating what you have lost. So
Wow.
there's a lot of different things
Amazing.
depending on what the problem is to thicken that skin, to cover the blood vessels. If you have pigmentation, like I was saying, that can be tricky to treat. And that's where we might do chemical peels first. And then lasers would kind of be like the last thing we'd look at there. Skin lightening agents are also a good option there, and vitamin C for sure.
That is amazing. You've given us so much good information. Okay, some of you guys are staying until the end. I know it's getting late, but do you think I could try and squeeze in one more for Stacy here? We didn't get to her question,
Okay,
and she
yeah,
was the first one to say
sure.
hi. All right, Stacy, this is for
Hi,
you.
Stacey.
I'm in my mid 40s and I'm starting to notice changes in my lower face and neck. Oh, Stacey, I am with you, including some skin laxity. While I'd like to avoid surgery for now, I'm interested in learning more about evidence-based non-surgical treatments that could address these concerns. What preventative and corrective options do you recommend for mild to moderate skin laxity in these areas, and what kind of realistic outcomes can I expect?
That's a great question. So it's a great question. Often, this is one of those things that if the neck, there can be a couple of different problems with the neck. And if the neck gets too far gone, like, sometimes I will have patients that come in. I'm very transparent. I pride myself on honesty and transparency. And sometimes I have patients that come in and I tell them, well, if there's just too much, laxity, I mean, they'll make the turkey joke themselves, usually, like a self-deprecating joke. But if there's too much looseness, so if the skin is hanging too much, and they really want it, or if they say like they really want it pulled like completely back, then we'll often come to the conclusion that, well, what you really need is a neck lift. That's something we don't. The one thing we don't do in this office is like facial plastic surgery. And the positive thing, it's going to be a very dramatic result. The negative things, like in San Diego, it's going to cost you an arm and a leg, and it's going to be a lot more downtime. We do have skilled surgeons here, so we can give you some recommendations. They're actually quite good at masking the scar. If you do want to do that, this is really for patients, I think, more who are like in their like 60s, 70s, who really haven't done like anything before, and like it's kind of like you really just need a dramatic result. Not for you, Stacy, who's in your mid 40s. But for other patients, we can absolutely do minimally invasive things. And what I find is really cool is like through the minimally invasive things and the maintenance things, our patients can actually avoid ever needing to do a facelift or ever needing to do a neck lift. I showed you that patient who had that excellent result of Dr. Fabi's, who has been a patient for 9 years. That patient is never going to get a facelift or a neck lift. Just doing minimally invasive things that aren't going to take, that she doesn't have to, lie in bed with a bunch of like, with a bunch of ice packs and like bruising all over, and stitches. Um, you know, um, just minimally invasive things that will take like a day to recover from. You can improve and maintain what you're looking for. So I'll show you some pictures. Of a couple kind of things we can talk about on the lower face here. So it depends. There's different problems for the neck area in the lower face. So this patient has a lot of wrinkles. So what I'm showing you is the Acure laser. Um, I've treated several.
Wow,
I say a
that's
couple.
amazing.
That's a minimize. That's an understatement. I treat a lot of patients, but this is one of those things that takes a long time to see the results. A couple of weeks. So you can see her neck lines are a lot better, but she still has laxity. So this is more so for laser. These lasers are more so for improving like the skin quality. So improving the collagen and elastin and tightness of the skin, improving those lines and the wrinkles. Astonishingly, this was one treatment. And what's really amazing is I'm going to show you like the downtime for this laser is nothing, which is crazy. But you can see here, same thing. The lines look so much better. still like this neck is kind of hanging out pretty far. And she still has like jowling. So she still has skin laxity, but the skin tightness and the wrinkles are a lot better. Same thing over here. This is the downtime essentially. So this is a patient who couldn't take a lot of downtime. They work in real estate. This is 3 days later. So for the first 3 days, they have this patient is like very red at baseline. That's not from the laser, but these tiny red dots, that's all that's happening from the laser. That's all the recovery is. So it's very minimal in terms of like the recovery. It's very, very easy. Like it doesn't require any time off work. And this is the laser, the same setting that result in like these results. It's the coring function on the ultra clear laser. So when you do a neck lift, essentially they are making a cut, they're pulling some extra skin out, and then they're cutting it off. What we're doing with this laser with microcoring is removing like 1 to 2% of the skin at a time. So we're doing the same thing, just in a very small amount of the skin everywhere. And we're doing it at a size where we know, like if you cut that like 0.5 millimeter of skin at a time, it doesn't result in any scar. So it's scarless, easy recovery, good improvement of that skin quality, but now it's not going to improve the laxity. Even if you do a skin, and even if you do like a facelift or a neck lift, it doesn't improve laxity. It just it improves laxity, but it doesn't improve the skin quality. So these are two different problems. So what if you want to improve the skin laxity? I don't have any photos of it here, but the procedure we do is the ThermiType. And actually I can pull that up on our website here. And so our ThermiType procedure, this is really, really, really nice. It's one of my favorite procedures because it's a very, and we kind of got off top because this is also a result. It takes some time. It takes like 3 to 6
Type in
months.
Thermi.
Oh yeah, it's here. It's Thermi.
Right, yeah, or you can just click that Thermi button.
You can see here.
Oh, and it's segmented only for one doctor right now.
Oh, here, let me put on all the doctors. So
there we go.
So it's really nice to kind of, what this is that we make a tiny little opening on the sides of the jawline and the neck. And then we will do a small amount of liposuction, depending on how much fat you have. So we can contour the jawline, like you can see an improvement in her jowls. And then we additionally, let's see some photos here. Yeah, so then we will heat the skin up underneath. And the cool thing is the skin can take more heat underneath than on the surface. So we can heat it up quite a bit, and then that's going to stimulate the body to grow more collagen and to tighten what's there over the course of 3 to 6 months. You're going to have about a week where you wear like a scarf that's kind of like a wrap like this. So it is something with like a little bit of downtime. And then after, I should say, the first 3-4 days you're wearing it 24/7. After that, you're wearing it just like 3 hours a day, so you can still go to work. You don't have to take a week off. Like 3-4 days is sufficient. But what you're seeing here is like almost that like neck lift like result where this laxity is taken out. And so that's what's very impressive. And that result is very durable. So like years later, it lasts. So this is what's like the small amount of fat is gone, and then it's like really tightened in her jawline. When we get older, sometimes the jawline from the bone loss I talked about and the neck can kind of blend in. It's called a jack, but like this is what restores that tightness. And now, getting back to the idea of the talk, let's say you don't have the time, you just want something simple to kind of define this jawline. What can be done is what's called a Nefertiti lift. And so there's a muscle here that pulls your face down. And so I'm going to do it on my neck because it's very powerful on me. But so like when I go like this and you see these bands, that's what that muscle is. And it pulls our face down to make our neck and our jawline blend in. And so we put it's actually a pretty small amount of like neuromodulator, Botox or Daxify there. And it can kind of sharpen the jawline because you don't have it pulling tight so much. And that's something that's, there's no downtime with that. People don't bruise with that. It's an area without a lot of blood vessels. And then you'll see the effect within like 2 weeks. These are all patients who have like a really nice contouring of that jawline. I love this treatment so much. The Thermutite and the yeah, incredible. Great. So I think that was our last question. Thank you so much for attending, everyone.
Yes, thank you so much. I'm sorry, you guys, that we went over a little bit, but there's just so much good information to have, and we could pick your brain forever, Dr. Zubair. So I appreciate you taking the
Um,
time with us. I know you've
I'm,
had a busy day seeing patients.
I'm
I
gonna
think we
mention.
almost answered, huh?
Sorry, I was gonna mention one last thing I almost forgot
Oh,
for the next. One last thing we can do. I'd mention that's like very like no downtime minimal is we also do sometimes dilute radiesse for the neck. And
mm.
that's one of the similarly, it's a nice thing for the skin quality of the neck that it can improve it rapidly without a downtime. Sorry, you're saying what you said.
Okay, thank you. That's okay. Okay, and I'm in my early 40s, and Dr. Zubair is going to do one of these treatments on me for my sagging neck down here, I think December 13th. So I will document my journey and share it with you guys. I think we're going to try soft wave, and I don't know. So I'll document and let you know how it goes. But anyways, thank you so much for coming. Everyone, thank you, Dr. Zubair, for your time. So the first 3 people to call in the morning or to submit a form and book your treatment get 10% off, plus a beautiful skincare basket that we already have made for you guys. So I look forward to seeing you all in the office. And if nothing else, I hope that you found this very educational and, help cut through all the noise, like you said, all the propaganda and advertising out there. I learned a lot, and I hope you all did as well. And I hope you're all able to get in your little last minute, treatments for your holiday glow before the holiday season comes around so quickly. We are taking December off for our webinar series because everyone will be busy traveling. So we will see you all back in January. And in the meantime, stay tuned on social media. Please come in and see us. And what? You're going to say something?
Oh yeah, one more thing I wanted to say is that we talked about getting these treatments in before the holidays. So because of thankfully I've had a lot of demands, my patients have been great. We are opening up, and I do see patients on Saturday, but I'm opening up. They were booked out. I'm opening up an extra Saturday, November 23rd and December 14th, to
Oh,
see
that's
patients. So
amazing because you're
if
right. There are very few spots left to get treatments before the holidays. So thank you for telling us that. Thank you. All right. So we hope to hear from a lot of you guys tomorrow morning when we open, and we appreciate you staying over with us. It's like pitch black outside right now, but it is only 6:44. But anyways, thank you all wherever you are in the world or in San Diego, and we will hope to see you soon at Cosmetic Laser Dermatology. Thanks, Dr.
have a
Zubair.
beautiful night.
Bye.